You're welcome. Yes. So, before I continue, I just want to let each and every one of us be aware that this session is being recorded, and yes, the recording is for the purpose of documenting this class, and would be able to also share um would also be able to share this at the end of the session when the need arises. All right, so you're welcome to the first of its kind medical education masterclass in Nigeria. As much as I know, I think this is the very first one. And this is being organized by the Society of Experimental Clinical Anatomists in Nigeria. Okay. Someone would ask, what is the reason for this masterclass? Why are we having this masterclass? So the current leadership of SECAN has been thinking of ways to, help improve anatomy education in Nigeria. And part of the ways that the leadership has thought to do this is to contribute towards capacity building of anatomy educators in Nigeria. And so this is one of the avenues that we have utilized to achieve this intention. So the essence of this medical education masterclass is to help build capacity for quality anatomy education in Nigeria. And by so doing, the people at the front line of anatomy education and medical education are the faculty members, right? So it's quite important and necessary that we bring about this session in order to help our members build that capacity to be able to, transform medical education or anatomy education in Nigeria. My name is Matt Mbago, in case you don't know. Yeah, we've been introducing ourselves in the chat, so I also have to introduce myself. My name is Matt Mbago, and I'm the publicity secretary of SECAN, and also currently affiliated with the Izuchukwu University, Nigeria Department of Anatomy. All right. So having provided us with the reason why we are having this class, I would like to just remind us of a few things that we need to take note of, which includes sorry. All right. So yeah, so for us to be able to get certificates at the end of this session or this masterclass, like you all know, masterclass in the sense that it is a classroom. I know as educators, we already have our ground rules of how we want our classes to run, 75% attendance to be able to write exams and all that. So we are actually implementing that here as well. So to be able to get a certificate at the end of this masterclass, it is important that the full participation is being recorded, and the full participation includes attending the two sessions, which is today and also on the 14th, which is next week, Saturday. And it's not just coming to the class and then zooming off after a few seconds, a few minutes, but one needs to also have or achieve 75% active time. Yeah, there's a way we can be able to achieve this through a timestamp based on when the person joined in and how long the person stays during the session. And also there would be a post-event feedback. So when you complete the event feedback and meet the 75% active time attendance and also attend the 2 sessions, then you'll be eligible to get your certificates. All right. Can I get some reactions to know that I'm communicating, people are hearing me and following up with the communication? Yes, please, if you've been hearing me so far and you are in line with what is going on, okay? All right. Thank you very much for that reaction. All right, so moving on next, I would like to remind us of our upcoming conference in the next few weeks, and that would be the second DELSA 2026 conference. That's the 24th annual scientific conference of SECAN and the annual general meeting. This would be taking place in Delta State University. So in case if you've not heard about the conference, I'm just using this opportunity to remind you about the conference. Abstract submission is already closed and you can no longer submit abstracts at the moment. But however, you can still register for the conference. So early bird registration has closed and the late registration is still ongoing. And you have the different categories to register uh, on as a faculty, as a postgraduate student, or undergrad student, or as a fellow. So the different prices for the registration are also on the flyer, as you can see on your screen. You can also visit our LinkedIn page, which I would share the link before the class ends, so that you can also get more details there in case if you're unable to grab the details on the flyer. All right, so moving on, I would like to introduce our facilitator for this masterclass. So in case you have any question while the session is going on, please don't hesitate to use the chat box to drop your questions so that I can check that and see what's going on there. All right, so to introduce our facilitator for today, I'm sure a good number of us already know the facilitator, but still going to introduce him nevertheless. So our facilitator for this masterclass is Dr. Izuchukwu Okafor. He's currently an assistant professor at UMass Chan Medical School, where he is in the Department of Radiology and supporting the implementation of the VISTA curriculum, where they teach anatomy in the development structure and function course for the first and second year medical students. This curriculum simply talks about the integration of anatomy, physiology, and radiology. Okay, I guess one of these days we are also going to learn about how we can, adapt our own curriculum into uh, an integrative and innovative scheme like this. All right. Before he moved on to join UMass, in the US, he served as a senior lecturer in the Department of Anatomy at Nnamdi Azikiwe University, where he taught anatomy across multiple health science programs. And he also served as the department's postgraduate coordinator. Dr. Okafor has a PhD in reproductive biology from the University of Ibadan and Pan-African University. His research interest includes reproductive health, anatomical sciences, endocrinology, neuroscience, and medical education as well. He is one person I know that is very much passionate about improving medical education in Nigeria. And Hence, this masterclass finds him very much suitable to help drive our intention as a society. All right. He has quite a number of publications covering articles and books, and he's also a co-founder of the Life Sport Educational Project, which is a science engagement initiative that has trained hundreds of students and teachers in Nigeria. Dr. Okafor has also received several grants and awards for science outreach, and also he currently contributes to international initiatives in science communication, open science, and educational development as well. So you can see that our facilitator is someone who is very much committed to the science and art of education, particularly medical education or anatomy education as you have it. So in the next 1 or 2 hours, he's going to take us through this class and a few ground rules for the class. We have to take note of includes maintaining muteness. I hope there's a word like that. All right, so let's ensure that we are always muted. And like I said earlier, if you have any questions as the class is going on, you can use the chat box to drop your questions. It is a virtual session, so if it were an in-person class, I would have encouraged you to raise your hands and you can say Uncle I, something like that. Well, all right, so yes, let's stay muted at all times. Use the chat box for questions and then respect each other whenever you have a contrary opinion to any comments that a fellow participant has made. All right, so with these few points of mine, I hope I've not confused you with all I've said, but rather to make your minds open for this session. Over to you, Dr. Okafor.
Thank you so much, Dr. Smart, for introducing me, and welcome everyone. I'm happy to see us and reconnect with several of us. I can see names that I know, some of my friends, colleagues that are here. It's a privilege to be with you and learn together today. And I first of all want to acknowledge SECAN for this initiative and also for giving me the opportunity to share on their platform. And Professor Emmanuel Esom, the president of SECAN, I acknowledge his drive, to bring in professional development to the SECAN members. And thank you to all the executive team, SMART, for your support. Personally, I appreciate you. So today I want us to really relax. I hope you have a very wonderful position, like you've taken a good position to really learn, because for me, I'm here to also learn, from us, from the interaction we're going to have. It's going to be hopefully a mind-blowing one, an impactful one at that. So I want you to, anticipate that you're going to really learn something new, even if, probably you've had some of the things we're going to discuss, but probably you're going to learn it in a different way. So today we're going to look at, what we called effective teaching hacks. How to teach effectively is something I'm really passionate about, trying to drive, medical education to where it's supposed to be. And this even made more sense. I had a recent study that I did. For the last study I did, before I moved from Nigeria to the US, was about, why students, are failing. We did some qualitative interview, and some of the facts that we are beginning to see emerging from that data, showed us that, there is still some level of, well, I say that there is the lecturer implication in terms of, their contributions to the failure of students. So I'm feeling that this is the first thing we need to start doing, improving how we teach, what we do, and how we do things to affect the effectiveness of our learning process. So just to This is more like the life cycle, if you want to think about the life cycle of a teaching process, right? We have the pre-teaching, you have the during teaching, you have the post-teaching. So as we're going to be discussing, I want you to have this framework in your mind, you know, what, the teaching process is to you. For example, you want to talk about brachial plexus. First of all, let me apologize that I'm going to be using more of anatomy. I know that I have few of us that probably you are not teaching exactly anatomy or you're teaching something else, but I'm going to use, because we're talking, on the platform of SECAN, so we're going to adapt it to suit more of, the majority. So I'm sorry about that, but definitely you are going to be able to adapt it to wherever you are teaching. So have this in your mind all throughout our conversation in the 2 sessions. You have your pre-teaching, you have your during teaching, you have post-teaching. In fact, it's almost impossible for us to be able to exhaust everything that has to do with medical education. It takes a lot of time, couple of workshops, couple of master classes to be able to do that. But we are going to scratch as much as possible some parts of the process. So your pre-teaching, what you do before, you want to know your teaching resources, your classroom, is it there, your own competence, preparing for that class, your slide design, your teaching preparation, and then you go to the class, how are you able to communicate that thing you're actually teaching? Your verbal presentation, your class management skills, your engagement process, and of course, the assessment skills you use during the teaching process. And of course, finally, the post-teaching, which most times we only end up doing the grading, right? But beyond the grading, there is also the course feedback process that helps you to also evaluate not just yourself, but the course itself, the particular session you delivered in that course, and of course, the entire program as a whole. And then for this masterclass, this will be our goal. Our goal is that at the end of this session, you should be able to understand basic concepts. We're going to introduce us to some basic concepts. Some of you must have had some of them. Cognitive load theory, we're going to introduce you to learning, pyramid of learning. We're going to also talk about, cognitive strategies, and then we tie it down to teaching methods. And then hopefully all of this, we're going to wrap it up around how to build a reputable and a systematic teaching philosophy. But I want to start by asking us a question. This is the artificial intelligence, era. And do you still think that we need teachers in classrooms, and why? I was thinking about it, and I know that there has been an advocacy, especially in the Western world. We've been hearing, people can now probably, learn by themselves, probably self-direct themselves, and even graduate with a degree. And of course, there is now YouTube education, where people are going to just learn, earn from their learning process, just have proof for their skills and then begin to. But what do you think? Join on slido.com, just scan the code you are seeing and let me hear what you think. I'm going to be revealing what we're going to be seeing, what we are saying, to see, like, just give a word. What is that word that is that why for you? Why? Why do you think, teachers are still necessary? If I add what I'm being paid and how many tutors we have, in my own school, for example, and how much a medical school spends to be able to maintain teachers, is that really necessary, especially now that we're in the AI world? What do you think? I want this class to be very interactive and engaging, and as much as possible, feel free as we go on to, use the chat box, ask a question, stop me at any time. It's going to be, discussive in form. So just feel free to always, chime in at any time, with anything you want me to, stress on, or anything you want me to clarify on. So while I'm still waiting for that, we have 2 persons joined already. So why? Just one word, 2-word phrases. Let me hear what you think. Someone is saying learning, active. Okay, we're seeing some words. We just want to have a word puzzle of what we all think, why it's still relevant. that we still have teachers. Otherwise, what we are doing here will not be relevant, right? So why are we talking about teaching, how to make it effective if eventually, I can actually learn on my own, and I don't need a teacher. So when it's saying collaboration, engagement, sharing, isolation, okay, facilitate, okay, human interaction, okay, awesome. So I'm going to just allow one more 10 seconds, for maybe one or two more, and then we continue the discussion. Dr. Smart, please probably help with admitting people, just letting you know. Thank you. Okay, so I think now we're seeing effective understanding, maximum interaction. Yes, that's perfect. So we wrap it up there. And then this is, it's not far away from what we have here. This is also a word puzzle, trying to show us, what and what you can see, that the teacher adds, brings into the classroom, beyond what you're going to learn, from an AI. Typically AI can explain concepts, they can generate quizzes for you, they can summarize papers, they can do, almost anything you can think of, but there are things that are actually lacking. It doesn't provide context. I don't know if you have actually used, AI to, you ask AI, I'm having headache, and, what do you think is wrong with me? It's going to tell you a lot of things, but then it's not going to tell you the context of what your problem is. So you see that human thing that is missing right there, okay? You ask AI, when you are down, you're not motivated, AI will not be able to take your hand right up and be able to help you, through that process. So validation of what you are seeing, professionalism, ethics are things that are, emotional, they are in the affective, cognitive, learning process, and they are humanly directed. So this tells us that actually teaching is far more than delivering information. It's actually, especially in academic medicine, in medical education in particular, it's about professional judgment, it's about hands-on guidance. In anatomy, there is no way you cannot, use your hands. You have to talk about how to use your hands, how to learn practical things, how to be able to do things effectively, right with your hands. It's not just about theoretical learning, but being able to learn to be able to apply it. So you can see that AI cannot replace some of these features. So that tells us something, anyways, that the type of teachers we need in this era is actually changing. And if that is so, we cannot actually only do this, realize that kind of teacher, by using evidence-based strategies for teaching effectiveness. What kind of teacher do we need? We actually need teachers that will be able to interpret, they'll be able to mentor, they'll be able to challenge, they'll be able to inspire, and they'll be able to humanize learning. Okay, so this tells us that there is a new dimension of, teaching, that we expect to have in the AI era. So it means that, for example, in my institution, if you're not delivering, so if you're not delivering, they will let you go. You will let yourself go because you are going to be assessed, you're going to assess yourself too, and students are going to assess you. So you have to know that if I'm not delivering, I will just let myself go. So most times you don't wait for the system to let you know, you just let yourself know that you are not delivering. So you have to interpret things, you have to mentor, you have to challenge, you have to inspire, and you have to humanize.
Okay.
Now, I want to introduce us to some concepts before we continue that would really be helpful, for us to be on the same page as we discuss some of the things we're going to be sharing today. The first of it is active learning. You've heard this word over and over again, but what do you think active learning is? I'm going to give one person a chance to say what do you think about active learning? So one person, what do you think about active learning? What is active learning? If you hear active learning, what comes to your mind? One person, feel free to unmute yourself. If you're not, probably the person that is talking should just continue and tell us what active learning, if they don't mind. what is active learning? Or you can use the chat box as well. I'm my eyes on the chat box. Tell me what you think the active learning, talks about. Okay. Okay, someone says learning style that is participatory. Okay, that's more like it participatory. So there is participation, there is, activity, right? There is activity. Someone is saying student-centered learning using various strategies, yeah. So there is some form of strategizing, right? Yeah, I mean, there are many words, for it. People have talked about collaboration, social interaction, trial and error, discovery, just find your hands doing something, there's some form of, activity. Now, when you've also heard, about this kind of learning pyramid. You've seen it before. People will tell you when you do a lecture, just about 5% of that content is going to go in, right? And then when you go to the level of, practicing it, teaching others, you're going to learn probably about, 90% and 5%. This is a typical description of the active learning that, some of us you've seen this, you've learned in the past. They tell you, oh, yeah, 30% are going to learn when you add demonstration to it. But yes, there is what is called active learning, but this actually does not exist. This is not scientifically proven, that, when I take a lecture, I'm going to learn 5%. That does not define active learning. And of course, they have actually, the purveyors of this have actually, classified this as passive, being that lecture is passive, reading is passive, audiovisual is passive, and then you have the active ones being when you're actually discussing and so on. So I'm here to tell you that there is actually nothing, called active learning or non-active learning in that sense. Every learning is actually active. Neuroscientists, I'm sure some of us are neuroscientists here, right? So when any learning is taking place, as long as that person is engaged in that learning, there is some form of activity going on in the neurocenters, in the sensory, neurons, and so on. So there is an activation of the brain, at that process. Sometimes you see that even you see yourself learning things even when you are not paying attention. For example, I've had some, songs that I know they are beating. The beating just lives in my head without me trying to learn it. I'm not even interested, right? So what happens in those cases? So it means that learning can actually occur because the brain keeps being active. So there is actually nothing called active learning in that sense. But most times what we talk about is interaction in learning. We talk about activities in learning. We talk about interactive learning. So that makes even much sense. So when you hear people say active learning, just have that framework in your mind that they are trying to describe some form of, engagement in the learning process. Now, I'm going to show us a few pictures that will drive, the next point I'm going to talk about in this concept. This is a lecture. You are in a class and you are being taught, thoughts about prostatic secretion. And this is the slide of one of your lecturers. Now, another lecturer came. This is their slide. The same content, the same topic, but this is their slide. Wonderful, wonderful content, wonderful image. Then another lecturer came. This is their own slide. Same topic, same content, but, came out in different ways. And I want you to just reflect as you're looking at them. And then you went probably a seminar. They're teaching you about cognitive load. And they gave a very wonderful picture, nice diagram, nice content, but this is the way it looks. And then the same presenter, gave you another slide, a table trying to show you the research on what they have found. This is the table that they give you. Wonderful content, but we're going to talk about something. I'm going to show you another, lecturer. This one is actually my lecture. So I'm going to show you another, lecture, just for you to compare, what we have seen so far. And then we discuss some of the things that we're able to point out. Now, the prostatic lecture is this, for another lecturer. The first slide comes up with this, shows you a picture makes a strong statement in the beginning. This is actually what we call the assertive evidence. Probably we're going to talk it by the next session. Prostatic secretion makes up about 20-30% of the volume. So this is a focus, gives you a picture, and then on the next slide, he makes another statement and ties it up to an image, a particular place on that image that is being shown. Makes another statement, ties it to another image, and makes another statement and ties it together. And then went further to give you, a cadaveric, image that shows you a lot of things. You can see actually there are a lot of things. And sometimes you understand that in anatomy, it's impossible to even, you have images, you can't even, it's difficult sometimes to create new images. So you have a lot of things going on in that image, but then be able to use what we call the signaling principle to point out to what you're seeing. What is important is that they are moving you from just using 2D images, and they moved you to what exactly you're expected to see when you are doing donor dissection. So in the donors, you are going to see something like this. This is how you're going to see a prostatic ventricle, how you're going to see ejaculatory duct, and how you're going to relate them, in the positional sense. The spatial relationship, you're going to appreciate it just by looking at that image. In a lecture or in a seminar, this same lecturer gives you, instead of a table, gives you this graph, not just giving you a graph, using the same signaling principle to give you a direction of what they want you to focus on. Now they want you to see that there is a fair knowledge of the students and that knowledge seems to be decreasing. They don't want you to pay attention at any other thing in that image, but just what they want you to see. That is the most important part of their message. Now, for example, you did, maybe it's a qualitative research and you did thematic analysis and you of course, it's difficult to present, thoughts, especially when they are just words. How are you going to, explain them? And you have to somehow communicate them. What do? You start the first one, yes, you're going to communicate them in words, but you have to do that in a way and in a manner that you drag focus and concentrate, make the student to actually focus, sequentially. The first one, the second one, the third one, the fourth one, and you tie it up. So all of this lead to the next concept we're going to discuss, which is called cognitive load theory. So we're going to talk about that. I'm sure you know what went wrong in the other ones. Probably when we probably visit it, we're going to, learn more about it, but that's just a way to bring us into this. What happens when, we are learning? There is a psychological framework that explains how the brain processes information. So the amount of effort, mental effort that is required to process that information is what we call cognitive load. So when you are looking at something, for example, a student is in class, he's listening to you, looking at your slide, have their phone in their hands, the colleague next to them is actually saying something. They are all coordinating all these processes together. The mental effort that it needs to process the information you are saying begins to increase. So this is what we call cognitive load. Now you look at this picture, you're going to see that we have about 3 types: the intrinsic load, German load, and then the extraneous load. We're going to take it one after the other. First of all, the intrinsic load means the complexity of new information. Most times there is nothing you can really do about it. It's intrinsic. It comes with that new information. Anything you are learning new, for example, I don't know about the history of Ghana. You're telling me about the history of Ghana, calling names of presidents, how they were amalgamated and things like that. They are really, really complex information. How am I going to put that in my head? Same with anatomy. They're telling you about, nerves, arteries and so on and so forth. How is someone going to, this is quite complex. There is nothing you can do about that. That is intrinsic. In Nigeria, we call it follow-come, right? So follow-come. Now, the idea is that this is permanent. Like, I can't change this. Now, germane load is the load that helps us to, link the new information to what we already know. For example, you have 5, students with different experiences, different learning. For example, one has a former first degree, from another department. Another person had actually changed a department to another and has prior exposure. Another person, went to a very good secondary school and has actually learned some of these things that you're introducing at that second year and so on and so forth. So you see, learning varies, and they already have some form of long-term memory, what they have learned before, that they can link up to what you're trying to introduce. So maybe another one reads a lot of news and probably knows a lot about Ghana. So when you're talking about that, it kind of connects. So you see that the mental effort that these variants of people need to be able to learn will really be different. So that is what we call germane load. So germane load helps us to actually connect and be able to process the intrinsic information that is coming. Now we go to the extraneous. So what is it? Extraneous is like extraneous. It comes from any other thing apart from the information you're trying to share. For example, the student problems, that they don't have school fees to pay, that they are being booted out of their rooms, that they're having, other emotional complexities, that the teacher is not teaching well, that the slides are not working, that the teacher is just, I can't hear the teacher, and things, even environment, they are all extraneous load. So this is like, bad mood, inconsistency, confusing display, poorly primed lecture, when the lecture feels like hard work. So as I'm mentioning them, you're already thinking about, is this one intrinsic? Is this one extrinsic? Is this one germane, right? Feels untrue, for example, when information you're receiving from someone feels untrue because you already have an information. So that's germane load, right? It takes you more to process that information because you already know that what you already know is different. So it takes you, more, it takes your brain more to be able to process it and learn it. Hearing, anyway, the next thing we're going to look at is just a little bit of how the brain works and how you process the information in the learning process. Why you need to know this is because as a teacher, you need to know what is going on in the minds of those you are teaching. The way you are listening to me, I may not know what is going on in your environment, right? I don't even know whether you're just lying on the floor, on the bed while you're listening to me, or whether you're even, taking your bath and you hang your phone somewhere close to the shower, but what I want to control is what I can control, from my own end, right? So this is actually what goes on in the mind in the brain, of your learners. When the information start coming, the first of all is that the sensory memory takes it up, right? And the sensory memory doesn't really hold a lot. It holds, stimulus, usually very briefly. So it accumulates just, a couple of them, just like I highlighted before. For example, you are trying to learn, this person is talking, your phone is chiming light, and then the lecturer is talking, many things are happening at the same time, and your brain is coordinating them, all activating your sensory memory. But it's not all of them that will actually move into the long-term memory. It's going to forget a lot of those things. You see somebody, you're on the bike moving somewhere, and then you're seeing a lot of things on the road. You quickly forget things you're seeing. And then the one that you focus on is the one that the brain eventually moves to the working memory. It goes to the working memory, that continues. And of course, working memories also hold a lot. It also forgets a lot of things and moves the one that it prioritizes to the long-term memory. What makes it to prioritize them? One of the things is the retrieval process. We talked about the germane load, and we said germane load actually helps us to, find what we already know. So it becomes easy for this long-term memory to happen when we're able to retrieve what we already know and link it to what, we're about to learn. And how the brain does is that brain uses what we call schema. It stores information in schema. I'm not going to bore you with all the process, but you just need to understand that because schema is more like lumps of information. So it tries to identify, something that looks like that new information. It may not be exactly the same, but something that just looks like it. You've heard about horses before. Maybe you don't know about this special horse I want to talk about, but at least you know what horse looks like. That's really a good schema to match the other information. You've heard about, nerves before. Maybe you've not heard about brachial plexus, but at least you've heard about nerves, that human beings have nerves. It just wants to match you with that information so that it can now bring it to long term. So what happens is that as you retrieve that information, the one you already have, it helps you to be able to encode them in schemas and store them as a long term. And of course, as you keep rehearsing this over and over again within the working memory, and you keep hearing them over and over again, doing other activities, it becomes even more stabilized in the long-term memory. Again, we say that the schema construction, the automation process, is done by the German load. Now, what are we saying? What we are saying is that what you can do as a teacher is first to manage the intrinsic load, the load we talk about that is intrinsic, inherent in that new information. You want to manage it. How do I communicate this process? And that's what we're going to talk about. Some of the strategies we're going to discuss are going to focus on managing this load. Anatomy is so complex. How am I going to manage it? How am I going to communicate it? Right? German load. The idea is to increase it. How am I going to stem my students to bring out what they already know? Bring out something that resembles what looks like what I'm going to talk about, so that they can be able to merge it together and store it. That is why sometimes you read a lot of stuff, I've read a lot of things, I read. But, once this is not activated, it can go into the long-term memory. And of course, what helps some of us is that when you've done a lot of cramming, you want to cram very close to when you're entering the hall, right? So that immediately because of course, working memory doesn't take a long time. And it takes about 2 to 7 schemas, on the average. It doesn't, so you just, hold your head. You don't want to talk to anybody. Once you go offload that thing you've crammed so that you can escape. Yes, good, that could work because temporarily that can help you. But on a long term, definitely is going to be forgotten. Now, the next thing we're going to do is to decrease extraneous load, and that will lead us to achieve effective learning. I'm going to show us this. This is typical of a cognitive capacity of a brain of 3 students that are in your class, for example. You have the students, this is like their brain capacity, the cognitive capacity of their brains, and then they have the same problem. Bad teaching. Okay, no, not in your class, in someone's class. Bad teaching, bad lecture, bad everything. Now you can see the extrinsic load, right? It's really bad. Probably the teaching, probably other things, but it's equal. They are exposed to the same lecture, contributing to an heavy extrinsic load. But the first person has an intrinsic load higher than the others. The first person is typical of a student that is a novice, does not know, no German load, nothing. They are just coming, first year student, doesn't know anything at all, doesn't have any background, anything that has, or let me say second year student for those in Nigeria, you don't have any level of anatomy, anything medical at all, probably the secondary school biology. At this level, you're having the intrinsic load. Okay, then the second student, extrinsic and intrinsic. Now you have a space still in the cognitive capacity. What happened with this student is that this student actually has, German information, but is not engaged to learn. Remember, I talked about engagement, making that German load. So when you're not paying attention, even when you are ready to learn, you have that information, the German load will not be activated. Now, the C part is someone who has some form of information, previous information, like who has, previous learning occurred, probably had a first degree in something, and now engage in learning. So you are seeing German load coming up. So for these students, when you are exposing A, B, and C together, you can see why performance varies amongst the students. So that is why what we're going to be talking about, in strategies are how to help, all these 3 students together using these strategies to be able to carry everybody along. And that takes us to the next concept we're going to discuss, which is the taxonomy of learning. This is what we call the hierarchical framework for classifying educational objectives. We normally use it to develop curriculum. We use it to set questions. We use it to, assess our programs. We use it to evaluate even students and even learning process, even, every learning activity that is, is found in that curriculum we're delivering. Now we have 3 domains of Bloom's taxonomy. It's a popular thing, Bloom's taxonomy. We've had it being revised a couple of times. We have the cognitive one, we have the affective one, we have the psychomotor. These 3 things, happen, together. They are not, quite separate. The first one is cognitive learning. You're talking about the theoretical concepts, the intellectual skills, the knowledge acquisition, in fact, the theories, the knowledge acquisition, the critical thinking. That's where we talk about cognition. Affective is where we talk about the attitudes, how a student develops their values. We talk about professional ethics, values, attitudes, emotions that are involved. Remember that there is that person you were, before you came into the medical school. And after the medical school, it's not like they taught you new values or new attitude, but somehow you see that it impacted in your attitude because there is some form of affective, domain of learning that happens as you even learn, cognitively as well. Now, psychomotor is your hands and your, the activity, the skills you gained. For example, you're able to fix a slide, fix a tissue, for example, you're able to dissect, a human body. You're able to, do laboratory processes, like anything that your hands can do, assess a patient, identify something, in an image and so on and so forth. Psychomotor, they're about skills. So these three domains are what we're going to be looking at. Now, cognitive talks about, we have the lower order. The first three ones are the lower order of learning, or lower order thinking skills. And then you have, 4, 5, and 6, described as the higher order thinking skills. What we do is that you want to make sure that your student, stays in the, the particular level that the objective of your teaching, has, designated him to be. For example, typically you have, at the undergraduate level, you're expected to have, be able to remember whatever you are taught, be able to understand it, be able to apply it. This is the basic for bachelor's degree. For most programs, they expect that you should be able to remember it, you should be able to understand, you should be able to apply it, apply that knowledge, whatever you are taught. So at that level, that's the lower order thinking. When you come out to the master's level, they want you to begin to learn how to analyze, how to evaluate. And then when you talk about PhD, they want you to design, they want you to create a new knowledge. There'll be a construct, there'll be something, different that is original. So that tells you like the levels of, the order of learning. Now, remember, understand, apply. For example, in an undergraduate program, this is your goal. If you also look at the questions you ask your student, this also informs your assessment. You say define, list, memorize, repeat, state. If you want to test their understanding, you want to say discuss, explain, identify, things like that. You want them to learn how to apply. You now ask questions that actually bring out their ability to apply that knowledge, depending on what it is you are talking about. So this just to give us, that level to see, affective domain. You also see that affective domain talks about, values, attitudes. Once someone is ready to learn, it means that they are the first basic level of affective domain. They are able to receive learning. It takes some emotional, value or attitude to be able to receive learning. So at that level, they are receiving. When they begin to respond, for example, you have some students in class, they don't even respond when you talk. You try to do everything, they are not interested. They are, but at least they can listen to you. They are at the receiving end. They can now respond. They are now beginning to pick up some values. At some level, you see them, they are even advocating for even more teaching, for more explanation. They're even coming to you. These are all affective domain. So, and it grows as that learning occurs, as that student begins to, more of, that domain is being affected. And you see that this begins to grow at different levels. For example, you don't need to explain to a PhD student why they have to study. But an undergraduate, you are practically even begging them, telling them, why do you need to study? You need to come to class. Don't go for parties. Prioritize your classes, because at that level, they're probably at the response level. So their attitudes, their values, and some of those things have not been well formed. And as they grow, it also grows as well. So psychomotor, typically you are doing anything that with your hands. For example, you are trying to dissect, the student is able to copy and follow you as you wear your coat. You're trying to, put that scalpel. They're looking at you and they're able to, they're imitating. That's the first level. And they're moving to the level where they're able to do exactly, recreate what you've done. And then the level where they are able to execute the skills without needing any help from you, any direction from you. And then again to the level where they are now being able to adapt it. For example, they can now listen to music and be talking and be doing it. Now they are adapting it in different situations. They can now do not just the one you taught them, use the same skill and apply it elsewhere. And then they are now reaching the level where they are now able to now, develop their own new system of doing it. That becomes the naturalization level. Okay. I'm sure by now you have an idea of how this domain operates and the fact that these three domains actually work together. And sometimes you can't separate them, because when you are teaching a student how to dissect, you see that you are not just affecting the cognitive, you are also teaching them cognitive, psychomotor, and everything all of them work together. But let's just look at what it takes to perform a lumbar puncture, for example. It requires the three domains. The first is that the learner understands anatomy, that's the cognitive, the risk, the technique, and then the learner should be able to now perform that process, be able to handle the needle properly, that's manual skill, right? Maintain sterility and be able to perform that procedure. But when they are performing it, they are also able to show empathy, the professional ethics, the consent that is needed from the patient, needs to be done. All of this, is about the affective level of a domain. Now, we say that when all these three things work together and have been achieved in the learning process, that is when competence is actually built. So only when the three of them develop together is a learner said to be competent. And that takes us to the cognitive teaching strategies. I'm going to wait for 1 minute if you have just to answer one or two questions on that as we look at the cognitive strategies. Any question? Oh, Smart is telling me that our break is, okay, let's see how we do that. Probably. Okay, no question, so we proceed. Please, let's ignore the yellow thing on the script. I guess someone is trying to test our cognitive capacity, right? But we are fine, I'm sure. Smart, if you can help us to remove it, that will also be fantastic. Can use okay, let me try and do that quickly as we continue. Okay, done. Sorry about that. So the first cognitive strategy is to start from the known to unknown. Start from known to unknown, just like we've learned a little bit from the cognitive process. And what it does is that starting from that helps us to link, former knowledge, to clarify things and also consider. I'm going to be giving us examples as much as possible. For example, we're talking about brachial plexus. What are you going to do with this? How do you start with what they already know? For example, as an instructor, what do you say? You say, last week we studied spinal nerves, how each spinal nerve emerges from the spinal cord, carrying the sensory and motor fibers, and supplies a specific dermatome. And then, as I've told them about the spinal nerve, I'm showing them this image. At this point, I'm not stressing anything on the image. I just want them to have, an image view of what I'm talking about, to see actually where the spinal nerve, emerges from, which brachial plexus is one of them. And then, as I mentioned, the fact that it supplies specific dermatome, I change the picture to something else. They are now seeing, those dermatomes. I'm not stressing a lot about it. I just want them to remember what they have already learned, because these are all the basics, introductory level. And then I go further to mention, you also learn that the ventral rami of spinal nerve generally innervate the limbs, right? The upper limb, lower limb are all, innervated by the ventral rami. And I use that, to remind them of what they already know. Then I build a bridge and I say, think of ventral rami like major roads leaving a city. As the limb becomes more complex, these roads need to merge, they need to split, they need to reorganize to serve different purposes or to serve different muscles. And this forms the plexuses, the margins, the splitting, and all of that, forms plexuses. And I go further to show them, and I'm doing this sequentially. As I'm talking, I'm doing that sequentially. And I show them, now I don't want them to, I just want them to focus on brachials. I highlighted the brachial plexus from the fifth cranial to first thoracic, and is in the upper limb. I just want them to see, hey, you are talking about brachial. Our attention today is on brachial, even though there are others which I'm probably going to see later, right? The idea is to introduce brachial plexus. And then I introduce my new concept, which is brachial plexus. This reorganization of the ventral rami from C5 to T1 forms the brachial plexus, a network of responsible. Now I show them that formation as it happens, right? From the ventral rami, how it happens. And I go further to even show them now on the human body. The other one is more like, how it happened of not on the human body, but at least have a framework of how the spinal nerves gets to form this, and then look at the way it looks, in the human body. I'm not yet talking about different components. I'm here discussing it, but I'm just trying to create an image process for them to start thinking from the known to unknown. So that's the first strategy. Now, another example, cognitive strategy is spacing, what we call distributed exposure. Okay, this is what we call, the goal of this is to teach complex, things, in a repeated spaced revisits rather than giving it in a single chunk. For example, you want to teach about upper limb. This is the topic that I want to teach, the upper limb muscles. I know that I have had experience of having lecturers come to my class and then they dump the whole thing that they were not able to teach one time, just to me. I'm like, how do you want me to learn all of this, right? So the fact that you have timetables are based on this spacing, the distributed exposure. You want to have them distributed. Okay, so you make sure that the goal is to spread them in repeated pattern. For example, what am I going to do for upper limb muscles if I want to achieve distributed exposure? The first week, I'm going to focus on deltoid, supraspinatus, all the rotator cuffs, right? And I will introduce that muscle and then make an activity and an accident, label the rotator cuff muscles on a diagram. That's the activity I'm going to do in class. Probably if I'm doing that online, I'm going to do that, put up a picture and ask them to label and share something. I'm doing that physically and try to get them to do that as I move around. 5 minutes, this activity is done. This is the first exposure. Second week, I'm going to come. Now I'm trying to do a space review. I do a 5-minute space retrieval. I want to retrieve what they had already done. Now, before we move on, what are the 4 rotator cuff muscles and their main actions? So I'm reminding them back and I'm trying to activate space learning and then give them the new content afterwards. And of course, do another activity. I can say, for example, students should work in pairs, compare innervations of the shoulder versus arm muscles. And, this becomes my second exposure. Now I've told them the first rotator cuff. Now I'm talking about arm muscles. Third week, I'm talking about shoulder muscles, I'm talking about arm muscles, and I'm talking about nerve supply. So I can ask them, give them a table, ask them to fill in the blank spaces and to identify which muscle supply, which, is supplied by which nerve. Now you can see how I'm distributing them. And then I give my new content afterwards and then give them a color code to color code, the 4 arm muscles by the brachial plexus roots. This is now the third spaced retrieval. And then by the 4th week, instead of lecturing, I will not lecture. I'll just bring a case scenario. For example, a patient has a C6 nerve lesion, which shoulder, arm, or 4 arm muscles may be weakened. Now I'm tying up everything together. Do you understand? Now C6 ties up everything at the arm level, at the 4 arm level, at the shoulder level. So that tells you that the student will be forced to retrieve all that information, and you are helping them to actually not just retrieve them, but consolidate that memory and make it even firmer. And when they're able to do that, for example, when they connect it, they are linking the shoulder muscles, the arm muscles, the 4 arm muscles with their nerve supply. And then I'll now go further to do my final teaching, which will be on the hand muscles. And that will be my 4th distribution. Okay, I hope that's clear. And now, this is a bit different from organizing information in chunks. When we talk about chunking is when we are teaching a particular topic, but how you are teaching it to simplify it. Chunking helps more with trying to simplify things that are already complex so that the brain is going to take them in smaller chunks. For example, I'm talking about arm muscles, for example. How am I going to chunk it? Let me give you an example. I'm talking about cranial nerves, to second-year medical students. And my goal is to help them to master. I want them to master these 12 cranial nerves. I want them to know them. I don't want them to cram them. We talk about mnemonics. So I'm not a big fan of mnemonics. And I don't think mnemonics helps anybody. If it will help you, scientifically, I've not seen any proof. If it's going to help you, it has to be engineered. It's not a mnemonic that, in fact, if I tell you the number of mnemonics that you have to remember if you are learning anatomy, it's a lot. And there are different variants of it. You have the Navel, you have this one. There are many of them, but if it's self-owned, then probably it may help. Okay, but now you want them to learn it in a way that the memory will help them to learn it. The first chunk I'm going to have if I'm teaching this is to give them sensory only. I say, okay, these are the first chunk, sensory only, okay, of olfactory, optic, and vestibulocochlear. And I go the second chunk, I'm going to give them the motor only. 3, 4, 5, 6, 7. Okay, Smart is raising their hand. Smart. Hello?
Yeah, thank you very much. Yeah, just want to draw your attention to the time for the break so that you take
Okay.
note of that. And yeah,
Okay, thank you.
thank you. Yeah.
Probably let me know in another 15 minutes. Okay, thank you. So the second chunk, I focus on the motors only, purely sensory. So this way, I've helped the brain to split that information into sensory, purely motor. And now even I make a reference, I can even say, oh, the first 3 of this motor actually move the eyeball, another chunking. So I'm trying to point it at a particular function that helps them to also register that process. The final chunking, making it 12 is the mixed nerves, which also is the 5th, the 6th, like that. That's the chunking. Then I can also choose to do another additional chunking layer. Some people, you see lectures, they give you different forms. So choose the one you like. Now, I'm going to teach it based on where they're coming from, the exit from the brainstem, the midbrain, the pons, the medulla, and how they are coming from it. Sequentially, you can see that they are sequentially 3, 4, 5, 6, 7, like that. And I've put all of the 12, in that chunk, making it even simple. And I can also do a class activity using chunking, color the sensory only using blue, color the motor using red, and color the mixed nerve using green. And this activity can be done in very short time, especially for a small class, and making even how to manage this information even more meaningful to the students as well. Now, the next one, please feel free to stop me at any point for any question. Okay. I'm seeing a chat. Okay, someone said I'm a bit fast. Oh, okay. Uh, sorry that I'm already sorry about that. I forgot that I'm teaching Nigerian audience. This is actually how fast we used to be. Oh, okay, I'm going to tone it down. But please let me know if you need me to rewind on some things. I don't mind us understanding things better than trying to say things and we don't understand anyone at all. So please let me know. Thank you for that. Okay. So guided attention, I'm going to slow down now, but not too slow anyways, but I'm going to just walk in the pace that that'll be good for everyone. So guiding attention, when you want to guide attention, you typically want to, help the students to, put their attention on what matters. Remember, the idea that what you're trying to achieve is that you have objectives for anything you are teaching. For example, if I'm teaching medical students, my objective is different. If I'm teaching, those who are doing physiotherapy, my goal is different. If I'm teaching, even a resident doctor, my goal is different. If they come to my lab, I'm trying to, use dissection. I'm teaching them, I'm paying attention to something. There is an objective that the institution or that the program wants me to achieve for that particular class that I'm teaching. And I need to focus on that. So guiding attention helps you to guide the attention of the student to what is very important for their learning process. Now, for example, for anatomy of the heart, there are many ways you can do that. The instructor can say, you can post, a large image, an image of the heart. And, image of the heart is complex. You post it, it can be scary. What am I going to focus on? You can say, right now, focus only on the major external landmarks. I can want to just focus on the 4 chambers. Just want you to appreciate the 4 chambers. Nothing else. Ignore every other thing. That's a way to guide attention. Again, I can also highlight using laser pointer. You've seen me do it in some of them. Laser pointer, use laser pointer to highlight what you want them to draw attention to. For example, you can even use, say things verbally. This is an example. Now I posted this, then I would just want to say, as I'm saying it, I'm putting that right attention. I'm trying to compare, and I want the attention to be on those numbers, and I want the attention to be on just those things that I'm highlighting. Same here as well, and same here. There's a lot to look at in this image, for example. But as I'm saying it, I'm putting at what matters, for them to pay attention on that particular thing. Now, again, you can also repeat, pause and repeat. For example, you can say, keep your eyes only on these four structures. For example, if I'm also drawing students' attention to even what, they should pay attention, for example, for their USMLE preparation, I'll say in USMLE exams, you are expected. So that draws their attention because students want to pass, right? So they want to, pay attention to what will really help them, what is really important, out of all these complex things I'm saying. That's a way to draw attention. The next thing is stimulating recall of prior learning, a bit similar to some of the retrieval, but, a little bit different. Now, muscles of the forearm is what I'm teaching in this case. An instructor can say, for example, before we look at the forearm muscles, take 1 minute and list the muscles of the anterior arm. So I'm trying to recall what I expect the person is expected to know or expected to have been taught, before that process. And students will recall. And of course, as they are trying to recall, what I'm doing is that I'm priming their neural pathways, preparing them for that learning process. I can even further ask them, which nerve continues down the forearm to supply most of, because you can't teach forearm in isolation. So I have to say, which nerve continues down from the arm to the forearm to supply most of the muscles of the wrist? And as they remember, it's the median nerve, right? Now, this bridges the content, the old one with the new content. I can even, use a question to do that. I can say, based on what you already know about the compartment, what do you expect, the major flexor to be located? Where do you expect the major flexor muscles to be located in the forearm? And which nerve do you predict will supply them? So this way, the student is trying to check. Now, I have not taught what I want to teach, but I'm also using question to make them to start thinking towards what I want to teach. And then I go further to now teach them what I want to teach them, which is the flexor group of the forearm muscles. So this is the recall process. Now, the next one is the deliberate practice. I hope I'm not fast again. I'm sensing that I've shut up a little bit. Sorry that shut up a little bit. Okay, deliberate practice. Now, for deliberate practice, the goal is you want to, help the students to actually, go through a repeated, feedback-driven practice. And the idea of deliberateness is the fact that you are deliberate in whether you are trying to make that recall, whether you are trying to, repeat an exposure, you are deliberate about it. That's basically what it's all about. So, for example, we are trying to help students to identify structures. It starts with the goal. Now, my goal is I want these students not just to, be able to identify all the 5 parts of the brachial plexus, the roots, the trunk, the division, and the cords, and the major branches. I want them to be 90% accurate in doing that. And I can tell you, if you are working in the West, like myself, you see that most of the curriculum, they have, percentages, like they're going to rate you. For example, the pass rate is 75%, for example. So you expect that a student that is having even 80% is failing. We usually you have majority of the students within 90, 9800, 98, around that framework. So you want to have 90% accuracy. So when you are teaching with that kind of objective, for that particular program or for that, so any topic you are teaching, you want to ensure you are deliberate in whatever you are doing for those students. For example, the first practice you're going to do is, for example, you want to ask the student to study a label diagram. This is an example. It can be done in different ways. Study a label diagram for 1 minute and then ask them to label the on label one. You give them two things, one on label, one label. They look at this one, you want them to label the other one. And as they are doing that, you are going back, giving them feedback immediately, right on the spot. So, oh, good job locating the roots. Oh, now focus on this one. Oh, good job doing this. Now focus on the other one. You are doing a corrective practice and it's deliberate. Okay. The second time, you can also say, okay, now proceed. Probably now you find them in the lab, the prosected cadaver, or even the one they are dissecting. You said, now identify the same structure. The same structure you gave them, they have drawn. You want them to identify it now in the human body, in the donor, right? Without any diagram. They are doing it. And they are doing it. So now look for the M. Remember the M we used to identify, the terminal branches, formed by the median nerve. So, okay, look for the M shape in the donor. Can you see that M shape? As you're trying to help them activate that process, for them to target the right thing, you are also trying to help them deliberately to be able to learn that particular thing. And then again, you are trying to now deliberately retrieve. For example, you now ask them in class, find a partner, let them, you guys should identify this individually on a fresh diagram and spend 60 seconds to assess each other to know how many of you were able to draw it effectively, listen all the chords, all the different parts of the brachial plexus. And as they're able to do that, you're increasing their efficiency. You're also increasing their ability to just, reproduce what they have learned even more, fluently. They can do that, in a shorter time. Okay, so even under pressure, it means that, for example, if you are training medical doctors, you are training them to be, to be able to deliver even under pressure. They're able to do task and deliver even under pressure. Okay, I think at this time we're going to take a break for 5 minutes. I guess the 15 minutes mark is up. We're going to take a break for 5 minutes and reflect on what we have talked so far, and then we reconvene to finish up. So 5 minutes, stretch, take water as you need, rest, reflect, and then we'll be back. So we'll be back at Smart. What's the time by your own? Okay.
Yeah, thank you very much. So it's 6:22. So let's say we reconvene at 6:30. Yeah, let's reconvene at 6:30. So you don't need to exit the sessions. You can still be on here. Yeah, just take a break, stretch yourself, stretch those muscles, relieve those nerves. You know, I'm sure some of the nerves must have been tightened based on the position you are occupying. So stretch yourself, exercise a little bit, and then we'll reconvene. When we reconvene to continue, we're also going to be having breakout rooms, right? Yeah, we'll also have breakout rooms where we are going to do some interactive reflections and exercises. Thank you very much.
Hi everyone. I hope we're now refreshed. Um, I guess I'm going to go back. So we're talking about deliberate practice, and I've given a couple of examples on how to do that in different practice rounds. And this is the third practice round where you have to now ask them. This is similar to what we do in Think Pair Share, which we're going to still see, where you ask, your students to find a partner, let them look at that specimen and, be able to reproduce it, uh, draw, for example, the brachial plexus and label them and assess each other's work. And that way you are increasing their fluency and their automaticity as well. Okay, another round where you can also focus on their errors. For example, as they are doing those, you want to say, now I want you to practice only the structures. Probably they have made some errors. You now want them to practice the ones they have missed, only to focus on those. And that way you're deliberately, making them to repeat, that process to be able to enforce that learning as well. Again, you can also ask them to label the new diagram entirely without any help as a way to be sure that learning has actually happened. Now, frequent retrieval, or what we call active recall, actually helps to strengthen the neural pathways, especially related to the long-term retention. For example, a teacher can say, close your notes, take 2 minutes and write down everything you remember about the difference between blah, 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 whatever it is you are teaching. Just want to make active recall. You want to, I want to even say forceful recall, get them to start thinking on something. For example, you can also use peer retrieval, which is a similar example I just gave. Forming them in pairs is more like a pair think share, to do something that will, force a recall of what you want them to remember from the previous session. And then you can also do an instructor check understanding with mini quizzes. Use mini quizzes to check, what level they are at each point to be able to know whether you want to revisit some things, revise some things, or continue with the class. So active recall actually helps, performs even better than, for example, rereading. For example, in class, you see people who maybe you ask a student to read something and ask them, oh, we're not hearing you. You say, reread. Reread doesn't help anybody. What you actually do is to use some of these practices to help them to learn better. Now, let's look at the concept of metacognition. This is typically for the learner, for metacognition. It's helpful for the learner. It's actually something that people do for themselves to be able to assess their learning. But as a teacher, as an instructor, you can actually do it, help the students to, recognize this feature for themselves. And what it does is that you help the learner to plan how they learn, to monitor how they learn, monitor their understanding, why they are learning, and also to evaluate, how well that they have learned. And all of this put together helps them to adjust their strategies of learning and help them to learn better. For example, you want to teach a student, about the liver. How are you going to do that? The first thing, you come to a class, you want to begin the lecture, you ask them to spend 2 minutes answering some of these prompts. For example, you want to say, what do I already know about the adrenal organs? You want them to write it, make a note for themselves. What do they already know about the topic? What have confused them in the past? They should not tell you, they should not make a note for themselves. What strategies do they think? Do they think they learn better with pictures, with quizzes, with repetition, and so on? This is just for their own use. And then you can also ask them to, this is example of, I gave an example of what students can write. I know the stomach lies mostly in the, lower upper quadrant. I get confused about peritoneal relationships with the liver. I learn better with 3D models. This is just an example. And then you go further, to the monitoring aspect where you give them for instance, you say, you pause, as you are giving that lecture and you say, take 30 seconds to check your understanding. For example, you've taught, that lever at some point and you want them to check what they have learned. How well are they learning? That's monitoring process. Take 30 seconds, try to draw the picture of a lever and try to label some few parts. You want to know how much they can do that. Then you ask them, if not, what exactly is confusing you? They should note what their confusions are. And for example, they can say, I can't recall the posterior relations. I'm not sure of the bare area. I mix up some of the ligaments. No, these are concerns, right? And then you can ask them to note those things. And the next thing is that you have to now evaluate. How do you evaluate? You give them a 1-minute reflection prompt. For example, you can say, what is one thing you don't understand well now? What is one thing you still don't understand? Probably they're not able to draw, that's not able to, identify some things. Now you make them to say what they are going to do by the next class to be able to be sure they're going to learn it. Now you're helping them to keep track of how best they are learning, why they're not learning well, and what will help them to be able to learn better. Now, a student will be able to now start paying attention. They probably know, but they're not paying attention, but you're using metacognition principles to help them, to buffer their learning process and learn more effectively. This is an instance, but I'm going to skip it. Now, the next thing is to talk about timely feedback. Timely means you don't wait on a feedback for students. You want to be timely about giving them feedback at the instant. I know it's a common practice. We see students who will normally, ask a question in class and boom, the lecturer say, take home assignment, right? This is typical. So, and you are not listening in class or yeah, take it home, something like that. But timely unmuted. So timely feedback helps you to give prompt and constructive responses. It must be prompt and it must be responsive. You don't want to delay it before once that behavior occurs immediately, you have to give that feedback. This is an example. This is an example I put from my class. I was teaching them something and immediately I gave a checkup quiz, which I normally do, and then boom, I can see the variation in answers. And right there and then I gave feedback. So an explanation, is pulled. Of course, when you take the quiz, you're going to see the explanation pop up after you've answered. But then I still went further to address those confusions that they might be having from that question. Now we talk about interleaving or mixing topics. Mixing topics or interleaving. We use this to strengthen pattern recognition. You want to, for example, you are teaching, you don't want to teach students brachial plexus. Sometimes you see lecturers, probably you are teaching brachial plexus, but you want to you focus on what you are teaching. You don't even want to teach anything away from brachial plexus, you just focus on it. But if you keep doing that, it will not be good to actually integrate the student across what others are teaching. So somehow you have to interleave. For example, you have to, instead of teaching topics separately, like saying brachial plexus week 1, shoulder muscles week 2, and then movement of the arm. These are separate topics. First week, second week, third week. What can you do to interleave these topics? For example, if I'm interleaving it, what I'm going to do is that I'm going to probably go into the first week, I'm going to talk about the brachial plexus. And as I'm talking about that, I'm mentioning the muscles they are supplying. So I'm teaching them alongside with their muscles. That's interleaving. I'm mixing them. This is also the same reason why at a larger, course level, program level, you don't do anatomy all through the week. You interleave it with physiology, you interleave with biochemistry. That way the students are linking them up. You are interleaving, if I'm teaching the upper arm, I'm interleaving the embryology part at that same week. So that way, I'm now understanding better, how these processes happen. So when you think again to shift your lecture or to cancel your lecture, you might want to remember this interleaving. And then you might want to know that it might be affecting the students' learning process. Now, the next one is the think, pair, share. I think I've mentioned this a couple of times in some of the other strategies. It's still the same simple thing, ask a student to think something on their own find a partner to, merge and share what they have, what their thought process looks like. You can ask them a question. It can be discussive question. It can be a question to it. It can be even a one answer. It can be a justified question. They find a partner, discuss that with that partner, and then go further to share, having formed a common answer. The idea is that they work individually and then they go further to be challenged by their partner, probably who has a different answer, and they compare notes and strengthen their reason, their justification, and then they form one answer, and then you can ask them, okay, some of you should share what your groups, can find. So this is not a group now, but a pair, think pair share. So it also works very well, usually even in large class settings as well, it can be used. So the next one we're going to talk about is elaboration. We use it to help students to understand structures deeply, by prompting them to explain, connect, and expand. Now, you can ask students to elaborate. It helps them. You yourself can also elaborate. I'm going to be giving an instance. For example, ask the why questions. Beyond saying, what is this? What is the nerve? Ask why. For example, why do you think femoral artery is relatively easy to palpate in this region? Now, I'm not just asking you what is. So when I have gone to that level, I'm asking you to elaborate why. So it helps students to, start thinking about reasons to justify, the what's. And for example, they can say, because the artery lies superficially, because there is little overlying fat. These are some of the correct answers. And now they are not just, trying to memorize that thing about femoral artery. It is helping them to understand more about femoral artery, to understand some of other details, around that topic. Again, you can also connect their prior knowledge, use a prior knowledge question, connect to a prior knowledge. For example, you can say, how does the position of the femoral vein relate to what you already know about venous access in emergency medicine, or even just venous access? So the student can explain and say, it explains why the femoral venous cannulation is common, because the vein lies medial and superficial and is large and relatively stable input. So they are now using it to be able to apply a particular knowledge. What they already know is being integrated together. And this is a question you can help students to use to help students to elaborate things. You can also elaborate even as a lecturer, not just using students to elaborate, asking students to elaborate. For example, you are teaching articular cartilage. I want to elaborate it using slippery soap. I will say, think of now, I want to elaborate using experiences, everyday objects, what I see every day. Don't try in a bit to try to elaborate. You now use something that is not known to the students. For example, I'm teaching different set of, people, people from the Western world. I mean, they are different, their experience is different. So if I'm referring my experience in Nigeria, they are not going to relate, right? So I have to use what is relatable, what they can all relate with. For example, I can say, think of articular cartilage like the smooth, slippery surface of a wet bar soap. As I'm saying it, they're imagining like how the wet bar soap feels like, the low friction, how smooth, and how it makes a movement sliding with my hands. And that tells them something about the articular cartilage. That cannot be erased from their memory, okay? So you use that to consolidate that concept you are teaching. I can also teach them synovial fluid using engine oil, for example. So that is elaboration. So I'm elaborating and I'm using that to, as I make that connection, and I'll say in the same way, your knees and shoulders will grind painfully without synovial fluid. Now that makes even more sense, right? Now we look at what we call the dual coding. It's called the dual coding, the effective combination of visuals, and, verbal explanation. It's called dual coding. Anything you are combining with something to find explanation is called dual coding. What does it do? It improves comprehension and memory. You want to have an image memory. You want to have, a listening memory, both, memories combined together strengthen, the encoding process. This is an example. I'm going to throw this question to the class. How would you utilize this image if you are teaching, the facial nerve, for example? These are the three images. For example, I want to know, which one are you going to show first and why? I'm going to, again, give us chance to say something. And I really want somebody to try. These are 3 images showing different things. You can see the large visual is showing the pons, the meatus, and also the ganglion. The second one is showing you the relationship it has with the parotid. And the last one is showing us all the 5 branches, the 5 terminal branches of the facial nerve, across, different parts of the face. And if you are utilizing the picture to teach, how are you going to, remember we're talking about cognitive load, visual coding, explanation, and how are you going to use this? One person, I have 30 seconds, one person to say something to this. Again, somebody's increasing our cognitive process by drawing on our image yet again. Somebody saying something? Okay. You can use the chat box if we are not able to use to say something. For me, okay, let me go straight to answer the question. For me, the first thing I'm going to show is that the very last image, which shows the whole 5 branches, is what I'm going to. I don't want to show the first one first because the reason is because what is this? Like, where is it coming from? Do you understand? So, like, you just pop up and show this. Like, what is that? Is that a rope? What exactly is that? Of course, even a student that is at 400 level sees this will not know without this. With the annotations, you won't even know what that is. You won't even know where it's coming out from, which part of the body is coming out from. Even though I've had geniculate ganglion, where are we? Is it at the pons? Is it at where exactly are we at that level? I've had about trigeminal. I know that it can be like, what muscle is that? Stylohyoid, yeah, at the neck, but where? So I'm going to show the first one that kind of shows the human relationship, the spatial relationship of where it's coming from. Now, in that picture, you can make out, the pons, the medulla, you can see the brainstem, and you can see all where everything is coming out, and then the nucleus as well. So that shows me entirety. But of course, I'm not going to show that with all of those things. I'm going to remove all those lines on them and then just focus on the image and then point out to the specific things I want the students to see. And then after that, as I explain the tract using that, I now say, now I want to explain to you as it comes out of, the stylomystol process foramen, sorry, I want you to see the relationship it makes with the parotid. It actually enters and pierces and separates this parotid gland into 2. And I show the second one, and show the relationship it also makes with the superficial temporal artery and veins. So the second one comes in. And then before finally, I can now open up and say, now let me show you further relationship, as we open up even into the brain, and that becomes, a clearer way to utilize that. So it's about effectiveness, in utilizing them, not just about using images and using people, because they say, oh, images helps. You don't just use image. Sometimes you put image that does not even speak to what exactly, we are talking about. Okay. And now we look at concrete examples. What does it do? Giving concrete, the examples has to be relatable. They have to be, have meaningful clinical scenarios, that are relevant to what we are talking about. For example, I'm teaching students about, about the urethra and then, or prostate rather, and then I'm giving them concrete example, the kind of cases they are going to see, because these are medical students. I'm giving them the typical cases. Don't go and frame cases that does not exist. Cases that are relevant, that are common, that is what they will see on a regular basis. This is a common example. and I point out and I use it to, as I'm teaching the lecture. Same here, it's a typical example, and I'm going to show them this, right? And, typical example of what they are going to see, mark out the areas and ask them to answer, because I'm giving them typical example of what they can see while they are, doing their rounds in the clinics. Okay, I think at this point I'm going to take any question if we have one, and then we go to a breakout session. Any question yet? So let me quickly clear again the annotation on our page. Seems that our cognitive process is being tried today a lot. So let's clear that. Clear all drawings. Okay. So we're going to break out. I'm going to share a poll right now. The poll is going to be useful for us to find our groups. So I'm launching this poll. Once you quickly just take the poll so that the poll will help to divide us into groups. Don't overthink it. Just use where do you teach mostly? Like where do you find yourself? So that you just join the group. Please, I want us all to make sure that we're still waiting for 26 people. We're still waiting for 15 people, 10 more people to go. 5 more people. 5 more. 5 more. 5 more. Do we have people who are sleeping? We have to wake you up cognitively. 5 more. 4 more. 4 more. 3 more. Is it 3 now? Sorry. You went back to 6. Okay, I think I'm the one that is miscalculating. 6 more. Oh. Okay, I think 6 more. 6 more. Still 6. 5 more now. Please help us with time. Okay, I'm going to end the poll now, and I'm seeing that 1 or 2 groups. If you find yourself alone, let me end poll and create breakout room. So now, so please just tap your breakout room. Hello. Oh, my Zoom just
Yeah, okay.
now
We are
unexpected.
with you.
Oh, sorry about that. Don't know
Are
what.
the others in their own
Did you have the
rooms?
experience, Matt? Were you shut out too?
No, I'm still here.
Oh, so it's from my end.
But the others are in the rooms, right?
Well,
Because every other
I'm
person
not
is
sure.
still, the participants are still here.
I just shared the room now. The thing shut me
Okay,
out. So let me
Oh,
okay. My God. Oh, so they're saying they didn't see it.
yeah.
So let
Okay.
me do- you
Yeah,
if I
sometimes it can
can.
be a bit, let's see.
Okay, let me create. Okay, let's see whether you're going to see it now. Okay, open all rooms. The rooms are open now.
Yeah.
Okay, so based on your results, just join the room. You have 10 minutes. What you are going to be doing is I forgot to say,
Uh,
design effective learning activity for your students to learn the brachial plexus and develop competency in applying that knowledge.
okay, you can put it in the chat so that I can just copy it and put in the rooms.
Okay.
Or you can join each room and then share it. Yeah.
Oh. So design, have they all gotten to the rooms?
Yes, I think people are in the rooms.
Okay.
Yes. Yeah, people are in the room.
So by learning activity, we mean like what and what you are going to do. Like, are you going to have a lecture? Are you going to have a case like what exactly are you going to do to make sure that a learning process is achieved, learning goal is achieved?
Yeah. Have you shared it in the group in the rooms?
Yes, I shared in the okay, let me share with the room. That's another thing. Broadcast. Let me broadcast.
Yes.
Okay, I broadcasted in the rooms.
Okay.
Two people entered the waiting room. There are still
Let's
people who
see.
are here. I mean, there are people that are not here that are still, I'm still seeing 15 people outside. What's happening?
I don't know. It's supposed to have popped up on their say redirected me back here. Okay. Okay, some people are still unassigned.
They're
Uh,
not going to be on our side. They didn't join. Okay, let me
uh,
reshare again.
okay, I think we can
Yeah,
assign to, yes,
yeah,
let's
just
assign to. I'm assigning people now. I'm
typically
just
when,
assigning people randomly.
okay, just assign randomly, just
Yeah.
sequentially.
Yeah. Okay.
It's showing me that people didn't join actually, rather than,
Yeah.
please,
Okay, I guess those people had issue with maybe lock them off or
exiting.
something.
Okay, probably.
Yeah. Okay. Yes. Okay, one more person. Um, all right. Yes, everybody's in the room. The message.
So when are we supposed to?
I'm not sure they got any message. Can you check?
They did not get the message.
Yes, I don't think
Are you?
because I can't even find it in the group that
Because
I'm in.
someone is asking for help. So let me join breakout. Yes, hello. You called for help.
Yes, sir. We just saw the question pop up, but we couldn't fully grasp the question and it went up, so we were confused at what to do. We
Okay,
don't really
design
know.
effective learning activities for your students to learn the brachial plexus and develop like how they and to develop competency in applying the knowledge. So design any learning activity that you feel that will be helpful to help them not just learn it, but be able to apply the knowledge. Let's say you are teaching your students and you want to design something that they, learning activity, just, I've said a couple of them, and I just want to see, what we can do.
Okay, sir.
So I'll be logging off now, and I'll keep sharing that. Let me broadcast that again to everybody. I did that twice. Let me broadcast. I keep broadcasting. So I'm leaving your breakout.
Okay, sir.
You are not discussing yet. What's happening?
Yeah,
You have 10
maybe
minutes.
we were just
We were
waiting for you to
waiting for
leave,
you
sir.
to go.
Waiting for me to come. No, you don't
No,
need to
to
wait
Go.
for
like
me.
to leave our chat
This is
room.
this
I don't
is
want you
the
to
this is the
drop into what we are
classroom.
discussing.
Assume leadership, assume everything, collaborate and produce what you need to produce.
Yes.
Hello, everyone. It seems that I didn't give a clear direction. Please just start. That's why I decided to, rather than coming around the room, just to share what you need to do. I've shared it over and over again. Let me do that again. Okay, here you have it. Can you see it? Can we see it now?
No, sir. It just lasted a few seconds. You can display it again, sir.
Oh, okay. Okay, let me design effective learning activity for your students to learn the brachial plexus and be able to develop competency in applying it, the knowledge. Learning activities, like, for example, lecture is a learning activity, case study is a learning activity. What learning activity are you going to design to help them learn brachial plexus and develop competency in applying the knowledge? Is that clear enough? So let me go to another room. Which room is this? This is small class allied. Small class allied. Hello, sorry. I thought I noticed that the broadcast I was making, it wasn't staying for a long time. So your task is to design effective learning activity for your students to be able to learn brachial plexus and have competency to apply the knowledge. So that's your task. Design learning activities that you're going to do for your students to be able to learn brachial plexus and apply the knowledge. I think that's clear. So organize yourself 10 minutes and do that. I'll be sending you time notations. Any
Okay,
question?
thank you.
Okay, thank you. Hello. Design. Okay, only two of you. This is small class medical students. Design learning and very important too. Design learning activity for your students to learn brachial plexus and be able to apply the knowledge. That's what we are going to do, our task today. Is that clear? Getachew, right? It's clear enough.
Hello, Dr. Izuchukwu.
Yeah.
Nice to meet you, by the way.
Yeah, nice to meet you too. I know we've been friends for a while. So
Of course, yeah.
yeah, is the instruction clear, like what you're supposed to do? You're just two of you, but I mean the smaller the better, right? So
Okay, that's good.
Yeah, so design learning activities for your students to learn brachial plexus and be able to apply the knowledge. So learning activities focused on your particular group setting.
So
Sorry, I noticed that I was sharing, but it was staying for a short time. So
Yeah.
you're able to get. Okay, so your task is to design effective learning activity for your students to learn brachial plexus. Learning activities. We just want like design learning activities, whether it's lecture, whether it's like any learning activity you want to do, case studies, whatever that you feel is what you need to do for your group. You are teaching at allied, excuse me, allied health profession, a large class, large class setting. What are you going to design for them to learn this effectively and be able to apply, our cognitive level is to apply that knowledge of brachial plexus. I think that's clear enough. Let me zoom off to another group. Any question?
Yes. Yes.
Question.
Is it like a group work?
Yes, you're doing 10 minutes. Yes.
Okay, because I can't hear anybody's sound. That's why I'm surprised from our group.
Or just take leadership. I mean, the essence of group is for you to interact, collaborate. You don't need any appointed, you just come into a group and you start talking. And typically in groups, your videos should be on at group level, at breakout room sessions. So, but I'm
Okay.
leaving. Yeah, enjoy.
All right, sir.
I think I've covered all the groups. Okay, let me go and stay with one group that there are just few of them. Who is that? Group 4.
join and
Okay.
so
Oh.
I didn't catch up the full idea.
I decided to join your group. So
All right.
yeah, because there are just two of you. So let me just out, but I'll just be listening to your conversation. That's all.
All right. All right. What we are saying is that I joined lately, and likewise my Oga there too. He also joined lately, so we didn't really get the idea of what is happening.
Okay.
Yes.
But at least design the learning activity first. Like, I mean, it's something you can still do regardless of whether you are part of the class. It's actually an intro to what we're going to be talking next. Probably not today anymore. But let's see how that goes. So regardless, you can still design a learning activity, right? So you don't need that. I don't think I mean, just as you would think is the right way to do it,
Okay. Did you build something like objective of the class, the material needed, stuff like that?
No,
Because
just learning activity. The focus is just on learning activity. I mean, you can't use 10 minutes to do what you're talking about. So I just want to like, what are the things that come to your mind when you think about, medical students for small class? This is what you want to achieve, and this is what you want to do. Like, what learning activity do you think will support them? How are you going to help them to learn?
I suppose maybe preparing some printed brachial plexus and dividing the students into small groups of like 3 or 4, then distributing the picture, and at least I may incite them like to guess the location or the area, just to brainstorm them. Like, what do you think are these nerves, or where do they come from? At least just to brainstorm them, and maybe if I tell them about the brachioplexus, they may guess it may supply the brachial region. So I may incite them. What do you think, or where would you guess this plexus is located? Like they may not know all the branches, the chords, and whatever, but when it says brachioplexus, then they may guess where the location is or which muscles of which body region are served by the brachioplexus, just to give them some brainstorming.
Okay, I agree with you.
Okay.
I agree with you that for small class of for medical students, printing a paper that has brachioplexus and asking them to label, it's a fantastic idea for a very small class. Or if you are doing that online, um, shooting that image up and asking them to, or even putting them in groups, just like we're doing, and them being able to use the whiteboard, on see that paper on whiteboard, and then interacting, to draw, and as this person is doing, the other person is correcting. For a very small class, that's very feasible, online to do such activities. Yeah, so I agree. Okay, I'm going to announce, let me, Olari, what you said is not able to, is not here.
I
Okay,
think
are
the
you
issue
back?
it has been resolved. I can hear you now.
Okay. We were just discussing, and he made a contribution that you use print a paper, an image of brachioplexus, and ask students to use the label and all that. So I was adding another thing to it. I say yes, for a small class of medical students, I agree with him. And if I'm
Yes,
doing that online, I might do it differently because I might want to use the whiteboard, for example, shoot that same image and ask them, to do in smaller groups, even in say online platform. But if I'm teaching physically, yes.
Yes, sir. There is this.
Yeah, go ahead, Olaiwaju.
In fact, there is this thing. There is this. I have the opportunity to see at Uni Osun. I think that was last week. The way they did it, I was so impressed. But unfortunately, I didn't snap or record the stuff. It wasn't whiteboard, likewise paper stuff. In fact, some of them use wood to make some muscles. In fact, brachial plexus is there as well as other anatomical features.
Yeah.
When if I go back there, I will start it. Then maybe next week I can share it with the group, sir.
Yeah.
In fact, it was so easy. It's easier for small group students to be able to use it and learn anatomy. I was so impressed with it. I will stop it. Apart from whiteboard or cardboard, that one too is is something a smaller group can use to learn.
Yeah, I agree with you. I've seen a couple of different variations of that being done, but here in the West, I mean, in Nigeria, but here in the West, people use, we use different things. People even ask you to, I can even use a Play-Doh, ask people to create it, like use a Play-Doh, what a Play-Doh is, for making things. Children used to make things and shapes and stuff. Yeah, I can ask you to use that to, design it, more like you're building something, for a small group, it can just be a class activity, that I would do.
And
Okay, any more learning activity that will be useful for small groups? Did you see the broadcast I just made now?
No,
Oh,
no.
Yeah, I am.
Yes.
I think to get back to the main room, right?
what did you see?
We'll be back for after 4 minutes.
Yes, okay, you saw it. Okay,
Yeah, I am.
okay. Olariwaju, why didn't you see it?
I don't know. I don't know what is happening in my area here.
Oh, you should be able to see it. I mean, I'm not seeing it, but you should be able to see. I think because I'm the host, so I guess that's why.
So, Doctor, what other methods do you suggest for small groups of medical students?
For small groups, you know, small, you want to prioritize discussions, because you want to get closer to the students because you can, and there are not a lot of them. So you may not even want to be doing a lot of teaching, right? You want to, or more like you want to teach more closely, with them and teach them what they want to learn. It's not just about, teaching because you just have to wrap up the whole thing. Probably if you have exposed them to some things, you now want to come at level, okay, now let's see what you don't understand and begin to show them. Okay. One way you can do that is by doing think, pair, share can work perfectly well. Still the same picture, but in a think, pair, share format if you are doing it physically, for example. So if you're also doing online, you can also do a think, pair, share. So, but it's going to come up as group, the way we did breakout room, just two people, working together. So I've talked about using, creative activity, like building, trying to build this like a block because it's just lines, right? You just want to just build it. You can also do drawing activity. They can draw it. You can also do an activity where you raise, let's say, a table on your slide, and then you are filling the table together, as a whole, as you are feeling, they are leading you to feel it, not you leading them. As they are suggesting, you are feeling it. As they're suggesting, you are feeling it. After you did the first feeling all together as a class, you now ask them, they should feel it individually, and then they should check. Then you reveal the answer, they score themselves, and then now, they are kind of leaning on the whole group to also increase their own learning. I don't know if it makes sense to you. So there are many designs, formats that one can use, but now applying them, because the goal is to develop competency to be able to apply them. Okay, so you want to, you can match or match muscles with the plexus as you are doing that. You can bring, pictures that have muscles at different level at the arm, at the forearm, and try to match plexuses to it and ask them to color the ones that are innervated by this nerve, color the ones that are innervated by the other nerve, and things like that, or use crisscrossing to cross. So that way you are now, teaching them to apply, because the essence of the nerve is to supply something, right? To be able to know the function. So this is another layer to it. So not just knowing the names, not just remembering the code, but now what is being used for. Okay. If that makes sense.
Yeah, it really makes
So
sense.
the thing is that sometimes some of these things, you do it the first time, you take feedback, you revise, you do it, it becomes like you become, very conversant with it, and then you can do it even a lot better. Yeah, go on. I'm trying to message that time is up.
Thank you for sharing the previous methodology. I really appreciate it, and thank you, Doctor.
Yeah.
Thank you, Doctor. Thank you. We really appreciate that.
Yeah. Okay, I'm closing all the rooms now.
Yes, I can.
So in 60 seconds.
We will see you
Right.
in the big room.
Yeah. See you.
Thank you, sir.
Yeah.
Get to hear what they
Yeah,
learned.
please go ahead. Yeah.
Yeah, so I get to hear what they have learned, and then they get to also share their challenges, and then we discuss about it during the debriefing session. And then after that, you give them a post-class assessment, and then give them time to do a reflection of the learning process. Yeah.
Okay. Whose voice? Thank you, everyone. I hope you did enjoy. Sorry for the initial thing. Everybody was waiting for me to come to their rooms. I didn't know that what I was broadcasting was staying just for a short time.
Yeah.
So
Okay.
we had the learning activity done. So I just want us to share. I think Beryl is already sharing something. I'm not sure if I'm not sure if I'm correct, but I think she was saying something.
Yes, we were actually, I think the breakout rooms actually, I don't know where it threw us to, so we were just together, and it appears some people were kind of lost, and we couldn't
Are they
even though
found
they were in the
now?
group, yeah, but we are not sure if they were actually in the group. So yeah, we are just, Dr. Berio was just, kind of summarizing what we
Happened.
kind of thought about, the ideas we shared together.
Okay. Yeah, lost was found. That's great.
Oh,
I enjoyed myself with those in my group, Asai Bihan and Olarewaju. I went to
oh,
small
okay,
group
okay,
for medical students. That's the group I joined because they were just
okay,
two, so I decided to join them, and we had
okay.
wonderful discussion. So you might want to share. I'm going to give room for probably 3 groups, small, large, health, and medical. So when you go first, tell us who you are, so that tell us group you are speaking for and what you guys designed as a learning activity for brachial plexus. Remember to be able for them to be able to apply that knowledge, not just to learn it as well. So both must be, yeah. So who is going first?
Okay, sorry, before they continue, I know we have a little bit overstretched our time. The class is supposed to be 2 hours. I want to apologize for that. In the next 10, 15 minutes, we should be rounding up. So thank you very much for as many of you that have stayed up to this time. Thank you. And if you feel exhausted, you can actually, exit, but we will round up in the next 15 minutes. Thank you very much. Go ahead. Thank you.
Yeah, thank you, Dr. Smart, for that interception. Very important. We appreciate your time, and please feel free to leave if you have to do so. The attendance had already been marked for and up to the time, so we're not considering the extra times as part of the time put in consideration for that purpose. So who is going first? Who is going first? Small group. Any small group ready? Don't tell me we have not been teaching. So, so let's hear what strategy. The idea is to, hear what your context is about. Context. Yes, Vin, go for it.
Okay.
Your
So in
group.
our group, yes, in our group, it's for the allied and a large class.
Okay.
We were to design effective learning activity for our students to learn brachial plexus and apply it. Right. So we had that conversation, and first we said, okay, since it's a large class, we are dividing them into smaller groups, and then in each of the groups, what we said is that they would have their drawings, and then each group, they'll be expected to paint different nerves, okay, using different colors, for identification.
Okay. Yeah, I'm with you. We lost you, Vin. Are you still with us?
Yeah, maybe.
Anybody in that group to continue the
Yeah.
discussion? What he was just saying. Who is in the group with Vin? Can continue your conversation. What you guys agreed.
Every group. Can you hear me?
Yes, I think you are. I mean, it's your voice is, we are losing you and getting you back. Okay. Unfortunately, I can't remember the names in groups. I would have just, tried to suggest names. Anybody in his group that can continue, or any other group, any other large group. I wanted to ask Vin, what you are designing, is it for online? But okay, because you said paint, I know you can also paint, online as well. You can use whiteboard and, display the pictures, and they can be in groups and also paint. So I wanted to know, like, is this activity for you are teaching online, for example, or you're teaching is an offline event, like in person? That's also very contextual as well. So
Okay,
who is saying
it's
something?
all.
Yeah, somebody is saying
Can
something.
you,
Yeah, Vin, go
yes.
ahead.
No, no, the way we designed it is offline. We didn't consider
Okay, in
the
person.
online
Okay,
then.
okay,
Yeah. Yeah. So we say we'll do that painting, and then each student will paint the different the roots, the chords, and the branches and all that. And then we said we'll also have scenarios where we'll be able to identify various nerve, and then in the situation where there is a accident or injury to any of these colored nerve, what could be the likely clinical presentation? For instance, claw hand formation, Erb's paralysis, and all that. So you color which nerve, the damage of which nerve or nerves that will lead to a certain condition, and then to be written out by the student, and then how each injury would generally affect the function of the arm or the upper limb. That was what we were able to do, sir.
okay. I particularly like the clinical part of that design. I like the clinical part of that design. But I have my issues with design anyways. So anybody else? Anybody else?
Yeah.
Okay, Lillian, are you large or small?
Small class.
Okay, go for it. Let's hear the small.
Okay. Okay, our design is in a form of, like, first of all, we'll start with the recall, try to take them back to spinal nerves, then complete it with a picture of the spinal nerves,
Okay,
then relate the brachial plexus with a transformer that circulates power to regions, houses, and all that,
okay,
as to how the spinal nerves carry motor and sensory impulses to the different regions of the upper limb.
okay,
And then we go further to now show them a picture of the brachial plexus, then the components, list the components for them, and then now begin to take them on the clinical aspect, the damage to each part of the brachial plexus and what it could result in, and then a pictorial example of an individual who falls from a bike or during child, looks like angle of neck was um, um, tilted, like, and then what it results to in adult life and all that. Show them a picture of an individual with Erb's palsy, the presentation, the clinical presentation, and then the Crohn's palsy. And that, I think that's basically what we designed.
okay. That's a good one. Another good one. Good one. Any additions from what they have said? Like maybe you did something different from small or large. Anything to add?
I think we did something exciting in our group.
Okay, go for it. Which, large or small?
Less than 100, but more than,
Okay, middle. Okay, go for it.
yes, middle. So we tried to be a little bit creative on what was conventional. We tried to incorporate learners that were more activity-based people, hyperactive learners. Let me not say ADHD anyways, but people that like things that will make them move around. So Dr. Adeyemi in my group, he suggested an activity to start off with by telling the learners or students, as the case may be, to place their axilla by the edge of a table. So, just put a little bit of pressure. And it's expected that after a certain period of time, not too long, they should begin to feel numbness around their fingertips and the rest of their upper limb. So that activity should stimulate them to, in that euphoria, we try to say, okay, so what's causing this numbness? What's happening? What's in the axilla what's running through the axilla that is affecting this? So on that premise, we will now begin to introduce, the brachial plexus using someone suggested a cadaveric, diagram, and also placing it side by side with a graphical diagram like the ones we see in the textbooks, so that you can be able to compare and relate the organs around them. And then going further, please take note that the students we try to put as our context are students that already have a little bit of pre-existing knowledge. So there might not be any need to, start going from the very basics at that point. And then in a way to consolidate their memory, we also suggested that we give them something to take home. And, it could be a group discussion or something that will enable them to be able to practice what we've been taught. The suggestions like drawing the brachial plexus starting from the roots, the trunk, the division cords and branches. And then also we talked about having a handbook that had the diagrams, but then it wasn't labeled. So it will prompt them to have to label, the branches and the cords off without looking at, any material. And then also trying to just to make them feel, a little bit committed to that, trying to put it as part of a continuous assessment to put a little bit of seriousness to it. So I think that's just the little addition that we had that's different from what every other person is saying. Just a little addition. Thank you, sir.
Okay. Thank you. Okay, I think we'll be wrapping it up. Wonderful ideas, but you've had, all the things we said. The goal is not for me to give you like a model. No, the goal is for me to initiate that process that you start thinking around your context, thinking about possibility. Remember your resources, what you have, because I know even in your groups, your context might even differ even further, right? So your context, if I have a large group, 150, 200, 250, definitely I'm going to have challenges with management. And if it's not a curriculum-based integrated, activity, for example, we are supposed to, talk about that in teaching methods. We're going to see things like case studies. It's a session on its own, different from the lecture. You have, problem-based learning. It's a session on its own, There are activities that are learning activities that are sessions on their own, different from your typical didactic lectures where you just come to teach. Okay, so those ones are, within the curriculum. So you use them actively and you have more people involved, not just you, the lecturer. You have all the lecturers who have taught in that block or in that, program, come around, because the idea is we are tying everything together. We now want to have an activity to help them learn. So, but now in the setting we are talking, most of you designed your setting like, typical, what I know we find in Nigeria, where people just try to do what they can do within their own lecture. So within your own lecture, yes, you want to think about what can I do and manage on my own. In a big hall of, 200 people, how am I going to start sharing them in groups and be able to have oversight? We're still going to talk about, hopefully in next session, talk a little bit about management, scratch it a bit and things like that. What am I going to do differently? These are things you want to start thinking towards. If it's online something, what am I going to, do we have network stability and things like that? What kind of network will I use, or what kind of platform will I use to be able to have an efficient delivery of that process? Okay, typically if I'm doing large, I will typically go, try to flip the class, try to give them some things they need to learn, and try to, maybe use quizzes or use some things to make sure that, some quizzes that when you try to, you submit them, they give you the feedback as the answer immediately. So that way you can try it a couple of times, to see whether you are good at it. Or a picture. We have interactive guides where you have a picture image that is interactive. As you try to click, I will draw it as a map, as an image. This is like what comes to my head when I think of a very large class. You draw that, brachial plexus, and at each point, as you point them, you see pointers where you point to, see their labels. And I point them, I see it opens up and tells me what that nerve is. We have interactive, documents that can do that, even PDFs. So when we design something like that, that can serve that purpose, for that learning process. They can try it again and again until they get used to what the answers are. You can also design that, because we're talking about how to apply it. You can design that in disease model, link that nerve and put disease or structures, images that will appear. When you click it, it pulls up, something else that shows you the disease, the pattern, and maybe give you slight information about that process. That way, that's after you probably have taught them, after you probably have done recall in class and done some other smaller activities, just to buttress some points. So there are many models that can work perfectly, but the idea is think of your context, what could work most effectively, and what you can handle within your resources to achieve, effective learning process. And I think at this, we're going to stop here, and we have actually a take-home assignment to do, and I consider that very important for us. We're going to do that, but that will be, let's see. Let me see if I can share that right away. I'm going to be sharing. I just want to go through that and pull it up. So we've designed a Google Drive where you have more resources and where you can read, because definitely you can see how we're doing with time. Time is not our friend. And unfortunately, we have just 2 sessions and we can just do what we feel that is important. So I'm going to share back my screen again. Let's see. Screen 1. Okay. You can see my screen right now. So this is the assignment. There is a document called the Teaching Techniques in the Masterclass resource folder, which we are going to share with you. And after this session, so you're going to read it. It's just for your own purpose. Some of these things we discussed, small class, large class, different things you can do. There are a lot of suggestions as to what you can do. I mean, really, if you want to really improve what you are doing, it's a document you should read, and I'm putting it as an assignment, for you to read it. So read through the teaching techniques, for different purposes. You can also even see additional resources as well, even within that text, but what is there is quite exhaustive then. But the most important one, which will be submitted, is to identify, there's a document called Functional Anatomy Session Sample. This is a sample from my institution. What we do is a functional anatomy session that we do. What I want to identify is to identify the cognitive strategies that were used in that particular session, and also the teaching methods. Unfortunately, we didn't introduce the teaching methods today. We are supposed to cover it. It should take maybe like 15 minutes, but we don't want to stretch you anymore. So identify cognitive strategies and teaching methods that were used in that session. And then I want you to adapt that session to suit your curriculum objectives. You want to do something still the same, topic, but adapt it to suit your objectives, and try to see how you can, do similar session, to, adapt that document and send what you have adapted. We want you to send a sample. So that session, I'm going to quickly pull that. So you're going to send the customized session, the one you've customized, by 12th March. We're going to send you an email requesting that and send you a link by that time before 12th March, where you're going to upload, that document. And then also review your group submission before 14, because by then everybody would have submitted, so you can see your group. So when you go to that link, you're going to see different, folders for different groups, just like we've shared you. So you're going to maintain the group you are currently. So you're going to submit that document to your own group in that folder. Okay. So I'm going to open that file right now, and just to show you document, and let's see, go to can see my screen, right? So this is the folder. I'm opening the functional anatomy session. Okay, open the resources. Under the resources, you're going to see the functional anatomy masterclass assignment. So this is the session. So this is typically what we did, was that we had a physical class where, we pasted station 1 with this, this is a printed thing on top of the table. And then
sorry, we can't see what
you can't see what I'm seeing.
Yes.
Oh,
yeah.
Did I share the wrong thing?
Nothing is being shared on your screen, actually. Okay.
Oh, okay.
Okay, yes.
So this is the functional anatomy session. This is just like the material. So we had supplies of what we needed. We need a pair of shoes, a chair with legs. The idea is, okay, I'm going to show you the objectives. We had a bathtub, we had a car, we modeled a car, and we had stairs on a hill, stairs, or, a hill, just seat that has like 2 layers where you can climb, something like that. And we had resistant bands, the band that you just pull like a stretcher, they use for exercise, that tight band. And then we had a plastic skeleton as well. So the goal is to demonstrate the actions of the lower limb to perform activities of daily living. So we want to see, how our students learn, actions of what lower limb can do with respect to lower living. And then, of course, innovations and also adaptive equipment that are useful. I think this is also, the third objective is also useful for example, those studying anatomy at the bachelor's level, because you want to teach them adaptive, assistive technology, for example, for them to start thinking about. Now we're talking about entrepreneurship and creativity. So the first station, they're going to have a different thing on first station printed with the materials. This is the answer, which we turn upside down, we hide it, we print it together with so when they finish the activity, they can check the answers and see, what they have, So when you take your time and read through, you will see. So second one, third one, but let me show you fourth. So we have 6, they keep rotating. We have like a timer, 4 minutes per session, per station. And when the timer counts down, they switch, and each group is usually a group of how many of them? I think maybe 7, 8 thereabouts, not more than that, usually around 7 and 8. And that group coincides with the group, they use for their dissections. Most times there are 3 in their dissection tables. So we merge 2 groups together, for one group for this purpose. So you have about 6 stations. And yeah, so I just put a picture. Luckily for me, I took, because this happened 2 days ago, so I just said, let me take a picture just to put. So this is the picture of the setting. You can see the tables you are seeing are more like the groups. So you see the timers on the screens, and they keep rotating around as they finish that activity. Okay. So now when you read through, you understand what happened and how everything went and what you might want to do differently in your own case. So submit that as part of the assignment, and we are going to meet next week. So next week, we're going to talk, we're going to briefly about teaching methods, which we're going to identify, as part of this assignment. And of course, I've given you written materials to read up as well. And then we're going to now touch some other important things that I will consider vital, for this session. So now I'm going to open the floor for questions if you have one. Any questions so far? Question on the assignment or question on what we have talked so far?
Okay, so these teaching techniques, are you sending it to our email or how are we getting it?
Yeah, it's already on the folder, so it's just for us to, I think we can even share the link to that right now. We're going to share it so that everybody can get it, because I'm sure everybody's not here. So we're going to send an email to that effect.
Okay, sir. Thank you.
Does that make sense? Okay.
That's fine.
Yeah. So I figured out we already passed the time, so some people are not here, but because we're recording, so hopefully get to be able to review. Yeah. Any questions? Questions, comments, clarifications? So over to you, Dr. Smart.
All right, thank you so much. It's been an interesting class. This is really a class. I mean, why I call it a class is because it's quite different from, just seminars or just talks and stuff like that. I like the practical aspect of it, where we had to go into groups and do some activities. And I also gained a lot. I believe every other person gained 1 or 2 things. For example, I I actually like the exposition on the active learning. The active learning, it's not just what we think it is. It actually incorporates a framework that incorporates different activities that are happening at the same time. I think that's one of the key takeaways for me from this class today. So I learned something, and I want to believe that every other person learned something. I guess they are too shy to speak, or maybe I don't know. I don't know the right adjective to describe how they are feeling, or maybe they are feeling perhaps in a way. All right, but I think they could better use some reactions to, show or indicate that they learned something. So if you learn something, of course, yeah. If you learn something, please use the reaction. If you can't speak or act, just use the reaction icons to demonstrate that. Okay. Yeah, that's quite interesting. In the era of digital technology, some people try to hide behind the scenes and express themselves. So that's allowed. Just like people wouldn't want to answer questions, in a typical in-person class setting. So thank you very much, Dr. Okafor, for this session. And thank you everyone that has been with us from the beginning up to this moment. I of SECAN, and unfortunately, the president of SECAN is not with us today. I believe by the next session he's going to be here and give some form of recognition to participants as well as our facilitator for the class. Please do well to follow us on our social media pages. I've dropped the link in the chat box. Please follow us on LinkedIn and also follow us on X. We'll be having our Facebook page coming up soon. So in case if you're engaged in different educational research related activities which you share online, please do well to identify with us by tagging us. And if you're not a member of SECAN, I would encourage you to register. You can reach out to me, or you can reach out to us through any of our social media pages to indicate your interest to register with the society in an official capacity. So, having said that, I would like to thank each and every one of us once again for the time that you spent with us. And I want to wish you a very good evening or very good rest of your day, depending on where you're joining us from. Thank you very much and see you next week.
Thank you, sir. Bye, everyone.
Bye, everyone.
Thank you very much.
Bye.
Bye. Thank you,
Thank you,
Dr.
sir.
Thank you, sir.